So another technologies are going to be the another investigation procedures are endoscopies. So these endoscopies are the very important in case of the so many different type of the tumors and also cancers. So these endoscopics, first one is going to be cystoscopy. So especially, so this cystoscopy also called as cystourethropy. So that means if in urethra, if any tumors in the urethra or in the bladders, so we are going to identify with the cystoscopy, or also called as the urethroskopy, cystourethropy. So that means we are going to study about the urethra as well as in the bladder. So this cystoscopy is the examination in which a scope is inserted through the urethra to examine the bladder and also urinary tract for structural abnormalities or obstructions such as tumor or any urinary stones or kidney stones. So if any obstruction in the ureters, so if you see here in the male, so is going to be this scope, the cystoscope is going to be inserted into the ureter. So here is going to be so until is going to check any abnormality in the in urethra or in the any bladder, any abnormalities, we are going to identify with this cystoscope. So this is nothing but is a small device is going to be used with a flexible device and also with a camera. So we are going to identify where the obstruction in the a urethra or in the bladder we can easily identify with the cystoscope. So the samples of the tissues, so maybe is removed through the cystoscope or also examination under the microscope in the laboratory. So after removing the cystoscope, so we are going to find the any if you want to take out any tissue from the particular organ, maybe in the from the prostate or maybe in the bladder. So if you take some amount of the tissue through the cystoscope also, is mainly we are going to use in case of the investigation procedures in the labs, in histopathology lab. So through that is the biopsy. The procedure is called the biopsy. So that is the one treatment, like an investigation procedure is cystoscopy. So next one is the colonoscopy. So this also important diagnostic procedures. Colonoscopy means the colon, we are going to view if any abnormality in the colon, especially the large intestine. So we are going to identify any abnormality in any ascending colon or transverse colon or descending colon. Is there any abnormality such as the colorectal cancer or in case of any obstruction in the colon? So we are going to find any with the colonoscopy. So here also we are going to insert the small device, flexible tube with the video camera, small video camera, and insert it into the colon. So this is going to be more than commonly this type of complications will arise after the 45 years. But nowadays, because of the healthy, unhealthy lifestyle, so many people are facing with colorectal cancers and also gastric abnormalities. So these are going to be identify the colorectal cancers, or if any polyps are present inside the colon, so we can identify with the colonoscopy. And next one is the endoscopic retrograde and also cholangiography and pancreaphotography. So this is going to be the especially is going to check the any abnormality in the gallbladder or in case of any bile duct or liver complications. So these are the ERCP. So these investigation procedures are going to be identify if any abnormality. So this also small flexible tube with the camera is inserted into the passage of the stomach as well as into the gastrointestinal system. So it enter into the gallbladder as well as the bile duct and also in the pancreas. If any abnormality, any tumor, or maybe any in case of the stone formations, so we can identify with this coloangio pancreatography. So these are going to be identified with the special investigation methods. So next one is the esophagogastroduodenoscopy, also called as upper endoscopy. So in the endoscopy, we are going to see the clear a picture images of our stomach, if any abnormality, any tumors, any carcinoma, or any gastritis, any ulcers, we are going to found with this procedure. So such as this is also called as upper endoscopy. So this is the procedure that allows the doctor to examine inside the esophagus, stomach, and duodenum. So if we send this small tube through the mouth and also is through the esophagus, pharynx, esophagus, and also stomach until the duodenum. So it's going to be it's nothing but it's upper endoscopy. We are not going to the down. So it's going to be upper part of the gastrointestinal tract is going to be examined. So here a thin, flexible, lighter tube called an endoscope is guided into the mouth, throat, into the esophagus, stomach, and duodenum until the duodenum is going to send. So any obstructions or any abnormality in the stomach and also duodenum, so we are going to identify so through this upper endoscopy diagnostic procedures. So the endoscope allows the doctor to view the inside this area of the body as well as this, and also insert the instruments through the scope, so to remove some sample of the tissues for the biopsy. So in case we are going to examine, as well as if you want to take any small like a sample from the stomach or duodenum or maybe esophagus, so through this like endoscopy, upper endoscopy is going to collect the sample, small piece of the tissues from the organs for the mainly for the investigation procedures, so such as the like a biopsy. So this is the another investigation procedures in the cancer investigations. So coming to the sigmoidoscopy, the sigmoidoscopy mainly, so if anybody having any problem in the like a lower digestive tract, so such as in the any colon and also rectum, sigmoid colon. So in this one, so if you see the anus and rectum and also sigmoid colon, so until here, so if any abnormality, so such as any cancers or maybe any obstructions, in case of we identifying the any previous infections or maybe any severe diarrhea or abdominal pain or causative factors of the constipations or any abnormal growth or any bleeding inside the sigmoid colon or anus and rectum. So we are going to identify with this special diagnostic procedure is called the sigmoidoscopy. So here also we are going to send a small flexible tube. So it's also going to insert it through the and also intestine, through the rectum into the lower part of the large intestine. So from here to the anus and rectum and also until the sigmoid colon, we are going to visualize any abnormality in the lower gastrointestinal tract. So and also an air is injected into the intestine through the sigmoidoscope to inflate for the better viewing. So if you are, sometimes if not clear like imaging, if not clear information from the colon, so doctors are going to send the air injector inside this colon. So because of these things, so it's going to give the like a bulging, it's going to give the more like a clear informations. So the sigmoidoscope also can use to look inside the rectum and as a lower colon for the polyps, any abnormal growth or any abnormal like area or any cancers. And also is there any in case of the, so this may also have the tool to remove the polyps. Polyps means any extra like a growth or abnormal tissue formations. And also if you want to like check take any samples of like for the biopsies also, we are going to take some sample from this sigmoidoscopy. So the sigmoidoscopy and also digital rectal exams may be used to together screen for the colorectal cancers. So along with like a finger examinations, digital anal finger examination. So that means if you want to identify any hemorrhoids such as the piles or many abnormal growth or fistula, fissures in the anus and rectum, if any other abnormalities also, we are going to find the any infections or any abnormalities. So we are going to find the sigmoidoscopy and through the physical examination.